Erika and Machi, is Lee.
Yeah, I'm Lee.
Today we are going to explain about hypochondriasis and obsessive compulsive disorder. When you have hypochondriasis, you're concerned about the idea that you have a serious disease, but it hasn't been diagnosed yet.
Unreasonable thoughts and fears refers to obsessions, and repetitive behaviors refers to compulsions. Obsessive compulsive disorders is characterized by unreasonable thoughts and fears that lead you to do repetitive behaviors. It's also possible to have only obsessions or only compulsions, and you will still have OCD. And we will talk about the prevalence, symptoms, causes, treatment of these two disorders. First, the prevalence. According to DSM-4-TR, there is 1 to 5% in the general population and 2 to 7% in the medical population in the United States. Here, DSM-4-TR means revised version of 4th edition of Diagnostic and Statistic Manual of Mental Disorders.
Patients of this disease are having a long-term intense fear or anxiety about having a serious disease, and growing the minor symptoms means you have a serious illness. And seeing doctors repeated times, and continuously talking about your symptoms or supposed disease with your families and your friends, and doing health research unnaturally, and thinking you have a disease after reading or hearing about it.
Causes, it is not clear why some people get this sick, and personality, life experiences, child raising, and inherited traits may all play a role. People who have hypochondriasis think they can get benefits of being sick, such as receiving attention, and most of them had the belief that an illness may be deserved. Deserved means a certain thing for a person. So most of them have the belief that an illness may be a certain thing for a person due to some past real or imagined wrongdoing.
There are 3 treatments. Psychological counseling is a primary treatment for hypochondriasis. Education about hypochondriasis is a type of counseling, but it helps you and your family better understand what is hypochondriasis and why you have it and how to handle it. And in medications, certain antidepressant medicines are helpful. Antidepressant means medicine against depression.
The prevalence of obsessive compulsive disorder of approximately 2.3 of the population between ages 18 to 54 suffers from OCD. And the symptoms, anxiety is the most significant symptoms of OCD. You may be very sensitive to the thing which have already happened, but it did not follow your thoughts. It's like unwanted thoughts is like sometimes you have a fear of getting dirty, and sometimes it's like satisfaction. You have the strong will that the things you see are orderly and balanced, like the shape. You want it to be balanced, and sometimes you want the things to be orderly. And sometimes you also imagine that you hurt yourself or someone else.
The exact cause of of this disease has not been identified yet, but possible reason for this disease are abnormalities. It means not normal, and the change of brain chemical and genetic influences, environmental factors or biology. In biological factors, OCD may be the result of changes in your own natural chemistry or brain functions. And also, OCD may have elements from genes, but specific genes have not been identified yet, so it needs more research. In environmental factors, the factors such as infections, it means person's thoughts or customs affect to another person, are suggested as a trigger for obsessive compulsive disorder.
Treatment, obsessive compulsive disorder treatment may not result in a cure, but it can help you bring symptoms under control so they don't disturb or interrupt your life. There are two main treatments, psychotherapy and medications. Exposure and response prevention, short by ERP, is the most effective treatment. This therapy exposes you to an object, then let you learn the healthy way to cope with the anxiety. But it needs a practice and effort by yourself. Certain medication can help control obsessions and compulsive OCD. Most commonly, antidepressants are tried first. Often, treatment is most effective with a combination of these two treatments. So today we have talked about these two disorders. I think both of them belong to a kind of obsessive behavior. The expression of people with these two disorders seem to be an anxiety. Also, there are no primary causes for these two disorders. People may or may not realize that their disorders are unreasonable, but you may try to ignore or stop your thoughts, though it probably increases your distress. It depends on your own willing, because there is no specific treatment. All of those so-called treatment or therapy can just only play a supportive role. So there is no, and last but not least, there is no clear medical evidence for these two disorders that people have a serious health problem. These are the references. Thank you for listening.